Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. Do you have noisy knees? Do they crackle and pop? If so, you might be at increased risk for osteoarthritis of your knee joints. This is the People's Pharmacy with Terry and Joe Graydon.
1 out of 4 people over 50 has knee pain from arthritis. When your knees hurt, it's hard to climb stairs, go for a walk, or go dancing. But managing the pain can be challenging. New research suggests that steroid shots into the knee joint aren't helpful.
What else can you do? What are the pros and cons of NSAID pain relievers or cortisone shots? Is there anything else that can ease inflammation?
Coming up on the People's Pharmacy, we welcome your questions and stories about how you manage pain.
First, this news.
In the People's Pharmacy health headlines, one popular treatment for knee pain might be doing more harm than good. A 2-year study published in the JAMA compared steroid and placebo injections into arthritic knee joints. Patients who got injections of 40 milligrams of triamcinolone every 3 months lost significantly more cartilage from their knee joints than people who got saline injections. There were no measurable differences in pain scores between the two groups. In other words, steroid injections provided no noticeable benefit and a certain amount of risk. The investigators concluded these findings do not support this treatment for patients with symptomatic knee osteoarthritis.
Patients with knee arthritis are sometimes encouraged to undergo arthroscopic surgery to repair the damage. New guidelines published in the BMJ, however, suggest that surgery doesn't cure knee pain or other complications of osteoarthritis. The head of the guideline committee told Reuters Health that this procedure does more harm than good.
Research to be reported at the American Society of Clinical Oncology in June shows that a healthy lifestyle matters even after a person has been diagnosed with colon cancer. In one study, almost 1,000 people undergoing chemotherapy for stage 3 colon cancer answered questions about their dietary and exercise habits. The investigators scored their responses based on how well they met the American Cancer Society nutrition and physical activity guidelines. Almost 10% of them had healthful exercise and eating patterns that conformed to the guidelines. They also maintained a healthy body weight. Over the 7 years of follow-up, that conscientious group was 42% less likely to die and 31% less likely to experience a recurrence of their colon cancer than people who were less careful about following a healthy lifestyle. When the scientists factored in moderate alcohol consumption, the diligent patients were 51% less likely to have a recurrence or to die of their cancer. They had longer disease-free and overall survival than the other cancer patients in the study.
Beet juice has developed quite a reputation over the last few decades. Now, Canadian scientists say their study demonstrates an effect of nitrate-rich beet juice on the sympathetic nervous system that controls heart rate and blood pressure. In the trial, healthy young people were given high nitrate beet juice or a look-alike, taste-alike placebo. When the subjects consumed beet juice, their nerve activity was lower compared to the placebo drink. Sympathetic nerve activity in muscles was measured during both activity and rest periods. It was lower after the volunteers had drunk beet juice than after they'd consumed the placebo beverage. The authors concluded that beet juice lowers the activity of the sympathetic nervous system, which in turn leads to cardiovascular benefits. Although these volunteers were healthy and young, the investigators foresee the possibility that beet juice could someday benefit people with heart disease.
Up to 30% of women with breast cancer have trouble sleeping. Worries about their condition may understandably keep them awake. Lying awake can also lead to anxiety about insomnia, which just aggravates the situation further. Now, clinicians at UCLA report on the results of a study of Tai Chi for these women. They found that the practice was as effective as cognitive behavioral therapy, considered a gold standard treatment for insomnia. For the study, 90 breast cancer survivors with chronic insomnia were assigned to cognitive behavioral therapy sessions or Tai Chi classes. Both groups met once a week for 3 months. Tai Chi is a Chinese martial art with slow moves and a meditative component, and the participants learned a westernized version. During the next year, the volunteers reported on their sleep and mood. At the end of the study, nearly half of the women in each group still were sleeping significantly better. They also had less fatigue and depression. Because Tai Chi classes may be more readily available than qualified cognitive behavioral therapists, this research offers hope for women who have been treated for breast cancer. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon. I'm a pharmacologist.
I'm Terry Graydon. I'm a medical anthropologist. Today we're talking about the health news that matters to you. Do you have crepitus? It sounds scary, but it's fancy medical jargon for noisy knees. If they creak, crackle, or pop, there's a possibility that you're on your way to osteoarthritis of the knee. An article published online this month in Arthritis Care and Research tracked 3,495 people for 4 years. These individuals were at risk for osteoarthritis, but they didn't have it yet. The researchers were busy teasing out risk factors, and it turns out that hearing your knees make noise is a risk factor for developing stiffness or pain in the knees in the future. Not everyone with creaky knees developed osteoarthritis, however.
Well, I'm glad to hear that, because there are times when I stand up and my knees pop and creak and crackle, and I'm not looking forward to the idea of knee arthritis. Well, we'd like to hear from you. Do you suffer from knee pain? How do you treat it? We'd love to hear about medications you use or other strategies that work to ease pain. Our lines are open at 888-472-3366. You can email us, radio@peoplespharmacy.com. You can also reach us with Twitter. We're at People's Pharmacy. You can share your own story about knee pain. What do you do for those stiff joints? Tell us about it. 888-472-3366.
Well, there was a lot of news this week, medical news about treating arthritis pain. And most of it, unfortunately, was bad news.
Well, cortisone shots. I think a lot of people think, well, I'll just get a steroid injection, and that will stave off knee replacement surgery, or it'll at least keep me functioning. But the JAMA article this week was pretty disappointing, I have to say. They had 140 patients, randomized, placebo-controlled. They gave them triamcinolone, which is a steroid, or saline. So neither the patients nor the health professionals knew who was getting what, every 3 months for 2 years. This was a Tufts University study. At the end of the study, there was no difference in pain control. So in other words, people had the same degree of benefit from saline as they did from the steroid, but they lost more knee cartilage, and that is not good news.
No, that actually is speeding the degeneration of the knee and probably over the long run potentially making the pain worse. Well, have you ever had cortisone injections into your knees or some other joint? How well did they work? What else do you do for achy knees? Our lines are open at 888-472-3366. You can email us, radio@peoplespharmacy.com, or reach us through Twitter. We're at People's Pharmacy. And if you've ever used home remedies, we'd really like to know which ones and how effective they were.
Now, there was another article that came out just this week. It was in BMJ.
Well, there were two, actually, and they're linked.
Yes.
They have overlapping authors. One of them appeared in the BMJ, which used to be British Medical Journal, but now, like NPR, used to be National Public Radio and now is NPR. The used to be British Medical Journal is now just the BMJ. But it's a big umbrella. It has a lot of journals under its umbrella. And there's another one called BMJ Open, and there was another article published there.
And again, it was not good news. It turns out that arthroscopic knee surgery for arthritis is big business, $3 billion every year. It is the most common orthopedic procedure. And the new guidelines that came out from this panel of experts, and these experts were from all over the world, Canada, Australia, Norway, the UK, they basically said, quote, "The panel is confident that arthroscopic knee surgery does not, on average, result in an improvement in long-term pain or function. Most patients will experience an important improvement in pain and function without arthroscopy." The lead author, and Terry, you'll have to help me with his pronunciation, Dr. Lee Semeniuk. I don't think I got that right. Can you do any better?
No.
Okay, well, we'll just leave it at Dr. Semeniuk. He says, quote, "It does more harm than good. Most patients experience improvement after arthroscopy, but in many cases, this is probably wrongly attributed to the surgery itself rather than to the natural course of the disease, a placebo effect, or other interventions like painkillers and exercise." So for people with knee pain, we don't have a lot of good news.
Well, the good news is that there are things that can help besides having arthroscopic surgery. And exercise is one of them. It seems counterintuitive that when your knees hurt, you should exercise. And obviously, you shouldn't overdo it and harm yourself. But actually staying active, keeping on moving those joints really does make a difference.
Yeah, but, when your knees hurt, it's kind of hard to climb stairs. As you said, it's hard to go dancing. It's hard to go hiking. It's hard to exercise. It
is harder to exercise, so you need to start gentle and, be gentle on yourself, but try and make sure you get to it every day. And we go to Charlotte, North Carolina. Anita, welcome to the People's Pharmacy. Please tell us your story.
Hello, Anita.
I'm 73 years old, suffered from intense knee pain for many years. Nothing really helped. No creams or painkillers or anything like that. And then last fall, I had a terrible outbreak of gout in my toe. I stopped eating meat because I had gout every time I ate any meat at all. And now all of my joint pain has disappeared.
Anita, that's amazing.
It's absolutely liberating, and as much as I enjoy fish, chops, and all the rest of it, none of it was worth the knee pain.
Oh, well, thank you so much for sharing that.
And I have no idea why. My doctor doesn't either.
Well, and I'm afraid we can't offer you any insights. What was it like to have gout? Because a lot of people go, well, what was going on with her big toe?
Well, I woke up one morning after having no forewarning at all, and my big toe was completely swollen. It was beet red, hot to the touch, and absolutely excruciatingly painful. And not only that, I thought sure I had been bitten by the dreaded hermit spider. So anyway, my doctor spotted it immediately as gout. And all I can say is you want relief immediately because it's extraordinarily painful.
Well, we're so glad that your gout attack led to improvement in your knee arthritis and other pain just because you changed your diet. So I think the vegetarians are celebrating your story today, Anita. Thank you so much for the call.
Thank you.
Bye-bye.
Bye-bye.
Now, Terry, help me understand the relationship between gout and meat.
It has to do with purines, and I don't know that much about it, but meat and shellfish, seafood, it's rich in purines, which are, I think, a type of amino acid. And because a high purine diet will often trigger a gout attack in a susceptible individual, people with gout are usually advised to avoid those high purine foods.
And obviously, gout is caused by high uric acid levels. Oftentimes, patients get put on medications that will lower uric acid levels, but in this case, diet did the trick. Let's go right back to the phones. Richard in Milwaukee, Wisconsin. Welcome to the People's Pharmacy. What's your story?
Hi. I listened to your show for one night, and I remember advice my mom gave me. I observed people in my family, the older people. My grandpa would always eat the cartilage when they had ham hocks or whatever. Grandma would make that sauerkraut and ham hocks. He was very strong at the end. I had knee pain, but it's gone away. I do eat, make a drink out of the sour cherries. I get soup bones and knuckle bones from the butcher.
Richard, we're having a little difficulty hearing you, I'm afraid. I'm taking it that you got some relief from tart cherries. Is that right?
Tart cherries and also eating the cartilage from
okay. So sort of like a bone broth. Well, Terry, that's not the first time we've heard about the benefits of tart cherries.
No, not by any means. And we have heard quite a few times that sour cherries or tart cherries or pie cherries, they're all pretty much the different words for the same thing, can actually offer significant relief.
Well, we've talked about the mechanism before, and we think it has something to do with the COX-2 enzyme that's inhibited.
You'd better explain that, Joe.
Celecoxib, Celebrex.
Sounds like you're talking pharmacology.
Well, it's the way in which inflammation occurs. It's a basic mechanism, and it looks like tart cherries may actually work about as well as celecoxib. Well, we are going to take a short break, but when we come back, we're going to talk about medications, like celecoxib and diclofenac and ibuprofen, meloxicam and naproxen. They do have some serious side effects. How do you weigh the benefits against the risks?
Have you ever tried a home remedy for arthritis, pain, and inflammation? Like maybe gin-soaked raisins, Certo and grape juice, or Knox gelatin.
What about turmeric? Have any of these non-drug treatments helped? Share your story or ask a question. Our lines are open, 888-472-3366. If our lines are full, and you can send us an email, radio@peoplespharmacy.com, or via Twitter. We're at People's Pharmacy.
You're listening to the People's Pharmacy with Joe and Terry Graydon.
If you value the health information you get when you listen to the People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible in part by Red X Industries, makers of utterly smooth creams and lotions that moisturize deeply to make dry skin feel soft and smooth. The number is 800-345-7339. The website is uttercream.com.
If you would like to purchase a CD of this show, you can call 800-732-2334. This is show number 1080. You can also find it online at peoplespharmacy.com.
Today we're talking about pain relief. It can be quite a dilemma. We invite you to ask a question or share your story about what's worked for you at 888-472-3366 or email us, radio@peoplespharmacy.com.
Well, the big dilemma is that the medications that are so frequently used, particularly the NSAIDs, they provide some pain relief. It's not great all the time, but they also carry some side effects, and some of them are pretty scary. We found out at the early part of this year that pretty much every NSAID carries the risk of a heart attack.
Right. We used to think that maybe naproxen was better, safer in some way, because there were a couple of signals that suggested drugs like Aleve or naproxen did not carry the same degree of problems, cardiovascular problems, that drugs like ibuprofen did.
Now, the risk is low overall for heart attacks or strokes, but it's there. And there are other problems, possibilities. Stomach problems, ulcers, for example, are more common. Kidney damage is a possibility with these drugs if you use them long term. So that's the dilemma.
That is the dilemma, and they all appear to carry roughly the same degree of risk. There may be subtle differences between some NSAIDs and others, but whether it's atrial fibrillation or heart failure or high blood pressure or liver damage or, as you said, kidney damage, all of the NSAIDs seem to be problematic. Let's go right back to the phones, 888-472-3366. Where to, Terry?
We go to St. Petersburg, Florida, to talk to Mia. Welcome to the People's Pharmacy. Mia, what's your story?
Hi, Joe and Terry. Well, I had been taking glucosamine. That did help. I was also in the process of losing weight. It came to a pound a week. My target was. But and losing weight, and one time I ran out of the glucosamine. And I'm a walker. I walk every day. And my knees were doing fine without the glucosamine even. So we're talking just a matter of 8-9 pounds that I've kept off for about 9 years. And for me, it happened to be the weight, the extra weight. And now that I don't have that extra weight on my knees, I'm fine. I still snap, crackle, and pop, but my knees are fine now.
Mia, that is such a useful message. And the doctors say, lose weight and your joints will do better, especially your knees. And it's true, but it's hard, and good for you that you were able to take those 9 pounds off and keep them off, and that it has made such a difference for your joints.
So, Mia, inquiring minds like mine want to know, how did you lose the weight?
Just by cutting back, moderation. I was cutting portions. I still ate the same foods, but not as much.
No magic wand.
No.
Well, discipline. Mia, thank you so much.
Thank you very much for the call. That is really basic information that we all need to pay attention to. Where to, Terry?
We go to Springfield, Missouri to talk to Judy. Judy, welcome to the People's Pharmacy.
What's up?
Thank you so much. Hi, Joe. Hi, Terry.
Hi, Judy.
I appreciate your taking my call. I pop and crack like I don't know how to explain it, but people all around me can hear it. It's not quiet.
That's not good when you attract attention.
No. And for a while it didn't hurt, but later on it began hurting. So I looked it up and tried to figure out what I could do to help, because I'm allergic to aspirin and I don't want to take the other pain pills. So I went to a doctor that sent me the Boston Heart Study blood test.
And
I came back with huge, unbelievable rates of inflammation. So I started with turmeric and piperine.
Right, black pepper.
Together, they're better together.
With a little bit of olive oil or some kind of oil. And then I started back on my vitamin D. I take 50,000 units once a week, and it keeps my levels around. If I take it regularly, if they're around 125, and my doctor's happy with that. But it stops some of the popping and the creaking. But for the pain, I use emu oil.
Okay, and you smear that on, huh?
Whenever it starts to bother me, I put just a light coating.
Uh-huh.
It doesn't take very much. And my $14 bottle lasts me about 6 months, so it's worth the money.
Now, for people who are not familiar with emu oil, how do you spell it?
EMU oil.
Okay, and you just put it on your knees.
Wherever the pain is.
Uh-huh, and that really makes a difference for you.
Well, when I first started using emu oil, I twisted my knee, and it popped all the way around, and I knew I was in trouble. And whenever I started to hurt, I put the emu oil on it, and whenever the pain would come back, then the pain would stop. And the pain has never come back. It was like I was tearing something inside my knee, and that has never come back using the emu oil.
Well, thank you so much for sharing your story, Judy. Somebody else might benefit.
I hope.
All right. Bye-bye.
Bye.
And Joe, Judy was using quite a few different tactics all at once, and we got an email from Dr. Paul. He is a DC, I think that means Doctor of Chiropractic. He says, I often recommend to my patients to try several things all at once because, like dinner, you can't just eat asparagus. Once the patient gets well, then I'll have them back off from one thing at a time to see what happens. Acupuncture is often the drug of choice for arthritis, along with turmeric, boswellia, and for osteoarthritis, glucosamine.
Well, that's such an interesting concept. I really appreciate that idea because, there have never been any studies combining different alternative medical approaches. But the idea of trying, 2, 3, 4, 5 different things and seeing what works and maybe what doesn't work and then kind of eliminating the things that don't work, that's really kind of cool. And, I think a lot of the health professionals who are listening, Terry, they say, well, where's the evidence? And, we love evidence. Evidence-based medicine is sort of where things are today. But we're just learning that, well, it turns out that the steroid injections that people have been doing for so long, thinking that they worked,
the evidence isn't there to support them.
Evidence isn't there.
The evidence isn't there to support arthroscopic knee surgery. So, yes, we do need evidence for home remedies and other conservative approaches, but and it will be great when the research is done. But in the meantime, look for the things that aren't likely to cause problems.
Now, I have to tell you that the idea of taking big doses of vitamin D once a week doesn't appeal to me so much. I'm much more interested in daily doses. As
we have been watching the evidence research on vitamin D, we have not seen that vitamin D supplements once a week or once a month or once a year, which they sometimes do, have made a big difference. It's good that they're working for Judy, however.
Yes. Let's find out about one of those NSAIDs from Bob. Bob, I understand that you've been taking meloxicam. It used to be sold under the brand name Mobic. How did it work for you?
Hello, Joe and Terry. Thanks for taking my call. My wife and I listen to your program every week and thoroughly enjoy it.
Thank you.
Yes, I had a little bit of backstory. I'm 64 years old. I had a football injury when I was 16 years old to one of my knees, ligament damage. After that, I played lacrosse in college 10 years after, and then I started officiating lacrosse in 1998. And what's important about that is that during a normal game, I will run 2 to 4 miles of sprints each game. So I have a lot of mileage on me.
I was imagining that you might be keeping in shape by officiating.
Oh, yes. It's a great way to stay in shape. However, I started to get pain in my left knee, which is the one that had the operation when I was 16. And I started trying all kinds of different things. I tried Aleve, and that didn't work. I was taking at one point 6 to 8 ibuprofen a day, and my doctor told me that was not a good idea.
He was right.
Yeah, and then I switched to DMSO, and that helped a little, but not a lot. And then in 2014, it was so bad that I would get up in the morning, put ice on it, drive to work with ice on it, sit at work with ice on it, and after a game, go to the store and get ice and drive home with ice on my knee.
You had a frozen knee.
A frozen knee, yeah. So I finally decided I really needed to see a orthopedic surgeon, and he said that this was a technical term, that he was going to go in and clean it up. So this was in the middle of the season, and he gave me an injection into the joint and said that would help for about 8 or 9 weeks. And 2 weeks later, I was back because it didn't really do anything. And he gave me another injection, and that one seemed to help a little bit, at least until I had the surgery. So when I had the surgery, there was some torn cartilage floating around, which he took out. And he said he scraped the arthritis off the back of my kneecap as well, and that we would be able to do that 2 or 3 more times, and then I would need a new knee. And here's how the meloxicam comes in. So he told me that he recommended meloxicam. So I've been taking that ever since. Every time that I have a game, and I'm just looking at the bottle here, it's 7.5 milligrams. I take 2, and this stuff is absolutely wonderful, at least for me. It works great. It relieves the pain. It relieves the swelling, and it costs less than ibuprofen, so I love it.
Well, I think your story reveals a phenomenon that we are familiar with that we can't completely explain, and that is one nonsteroidal anti-inflammatory drug, like ibuprofen, works great for person X, but not so good for person Y. And then, here it should be exactly the same kind of drug and work the same kind of way as meloxicam. But in your case, the ibuprofen wasn't doing such a great job. You were taking a very high dose, and the meloxicam seems to be doing it. So we can't explain that precisely, but we've heard this over and over again, and it's why we have a variety of NSAIDs. I have to tell you that meloxicam is probably no safer than ibuprofen or naproxen or diclofenac or any of the other NSAIDs. They all carry about the same risk. But on the other hand, you don't want to stop exercising. So it is a trade-off. And,
Where should you stop exercising?
No, absolutely. So thank you for sharing your story, and maybe somebody else will benefit from what you've learned.
I hope so, and thank you. I love your show.
Thank you very much, Bob. We really appreciate the call.
Well, Joe, the idea that what works for one person might or might not work for somebody else also applies to the non-drug alternatives. The one things that seem to work for everybody are the exercise and the losing weight, if you're even a little bit more than you should be. But not everything works for everybody.
Well, precisely. I mean, we've heard from people who say, that gin-soaked raisin stuff, boy, didn't do anything for me, but the Certo and grape juice was fabulous.
Well, Joe, we've got an email from Harmony who says, I've used a liniment for horses that has capsaicin in it, and it has given me great pain relief and allowed me to keep dancing 4 times a week.
Excellent. Well, here's an email from Karen in Maryland. Karen says, tart cherry capsules changed my life. I'm a 53-year-old female who was active until my chronic knee pain became debilitating. I tried ibuprofen and got no benefit, but it tore up my digestive tract. In the last month, I've been to my orthopedic doc who recommended RICE, rest, ice, compression, and elevation, and a corticosteroid injection. The injection provided some relief, which only lasted a couple of weeks. One day, a friend asked if I had ever heard of taking tart cherry juice to alleviate pain. He told me he has arthritis and it's made a difference to reduce his pain. I jotted down tart cherry juice, and an hour later, he came by and gave me a bottle. At first, it didn't help, so I tried tart cherry juice concentrate. That took the edge off my pain. Concentrate has a lot of calories, so I switched to tart cherry soft gels, 2 soft gels twice a day. Each day I noticed less and less pain. never expecting it to completely disappear. But by day 3, my knee pain was completely gone. I don't take any medications at all now, only Montmorency Red Tart Cherry Soft Gels. This stuff changed my life.
Well, that is such an amazing story. And we go back to the phones. Carol in Somerville, South Carolina. Welcome to the People's Pharmacy. We want to hear what you have done for pain.
Thanks. Hi, Joe and Terry. Thanks for taking my call.
Yeah. Hi, Carol. What's up?
Well, I'm a 66-year-old woman. I had a hip replacement last year. I was bone on bone. I have some arthritis, osteoarthritis that tends to run in my family on my dad's side. And my weight is good. I've always been, I'm a walker. I've always walked. And I decided I really need to make some changes because I don't want to see more surgeries down the road. So I started with a kind of a low inflammation diet. I try to look at leafy green vegetables. And in the morning now I'm doing turmeric, which seems to have helped a great deal because my knees had started to bother me. And so for a short period of time, I took meloxicam in between trying to change things in my diet and try to give me some relief. And so the meloxicam did give me some relief. I probably took it for about a month maybe. But I also at that time in the morning, I always do, I call it a protein shake. I put in non-fat yogurt. I've always put spinach in, but I added kale. I added beet juice. I added turmeric that I mixed with some pepper and some oil, and blueberries. And I love it. It tastes delicious. It's really, really good. So it's easy for me to stick to. And the odd thing is when I started all this, did not like kale and I did not like beet juice.
But now?
I like them now. Kale has to be baby kale. I have to be honest. I've tried kale 16 different ways, and I even made kale chips one time and they wound up in the garbage. They were so bitter. So, but then when I went to the farmer's market here in Somerville, one of the people who grows, locally grows kale said, and when it starts to get hot, we, plow it under because it starts to get bitter.
Uh-huh. We are coming up on a break. Carol, what is the punchline?
The punchline is walking, turmeric, low, and try to get a diet that really is a low inflammation diet. Leafy greens are great. Beets, I do the cherries as well. But
all right.
Any type of foods that are low inflammation have helped me tremendously.
Carol, thank you so much. We really appreciate your story. That kale shake.
That sounds like advice somebody else could use.
When we come back, we'll talk more about natural approaches. New research from neuroscientists shows how some remedies may be working, and we invite you to join our conversation. How do you treat joint pain? Our lines are open at 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graydon. If you're enjoying this People's Pharmacy podcast, why not head over to our website? Well, you'll find a wealth of information on medications, conditions, home remedies, and ways to keep yourself healthy. You'll find it all at peoplespharmacy.com.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible in part by Red X Industries, makers of utterly smooth creams and lotions, helping dry, cracked skin feel utterly soft and smooth. 800-345-7339. Online at uttercream.com.
If you'd like to purchase a CD of this show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 1080, or visit our website. It's peoplespharmacy.com.
Today, our topic is pain relief. Do you suffer from stiff fingers, sore knees, or aching hips? You can share your story or ask a question. Our lines are open at 888-472-3366. Or you can get in touch with us through email, radio@peoplespharmacy.com, or through Twitter. We're at People's Pharmacy.
And we'd love to hear your stories about spices and home remedies, and we're even going to talk a little bit about headaches. But first?
Well, first I'd like to mention Carol talked about a kale shake. And you want to be careful not to overdo on the kale. It's great to have a kale shake, but people have been able to get themselves into a little bit of trouble by having there is such a thing as too much kale. It can affect thyroid function, and sometimes you can get a little too much, what is it that causes kidney stones? Oxalate.
Really? From kale?
You can. You don't usually do that if you're just eating kale, but if you are managing to get huge amounts of kale into a smoothie or a shake, sometimes you could do that.
Let's go to the phones and talk to Scott in Springfield, Missouri. Hey, Scott, what's up with acupuncture?
Hey there, Joe and Terry. A few years ago, I'm 60 years old, and my ankles really were hurting. My wrists were stiff. And I knew something was wrong, but I didn't want to go to a doctor. Finally, I went to a doctor, and he said, "Hey, you got arthritis. Face it." And I didn't blame him. He said, "Just take Advil." So I took Advil, and Advil worked for me. But I had too many side effects from Advil.
What were they?
Bleeding.
Mm-hmm.
Yeah, a lot of bleeding. And because I was taking too much Advil. So then, one day, I have a store, and a man came in. And he goes, "Scott, I got something you need to try." And I said, "What is it?" He said, "It's this wellness band." I said, "A wellness band?" "Yeah." He said, "You put this band on and wear it." He said, "It'll get rid of your inflammation." Well, first of all, I didn't want to wear a band. But I said, "Well, where do you get those bands?" He goes, "I got a couple. I'll sell you one." So I bought one. I took it home that evening and showed my wife, and she said, "Well, you just wasted $30. And I laughed. We just laughed. And that guy told me, he says, "You give that an honest 30 days. He said, "Wear that band every day, take it off in the evening, then put it on in the morning." So I did. Within 2 weeks, I quit taking Advil. He got rid of my inflammation. I haven't taken Advil in over 3 years, any kind of medication, for over 3 years now. I try to eat healthy. But I got involved with this company, and I share that product with everybody I know.
Well, Scott, where do you wear it?
It doesn't work for everybody, but it works for many.
Where do you wear the band?
Pardon me?
I'm trying to imagine. This is a band. Do you wear it on your wrist? Do you put it around your ankle?
Yeah. I didn't know nothing about acupuncture, but it's holographic technology. And it sends a signal into an acupuncture spot, and that's how it works.
Well, interesting, Scott. We're not going to endorse any products, but I'm glad it worked for you, and that's kind of intriguing. You know, I would like to know more about acupuncture and arthritis, Terry. Are there studies?
There are studies, and the studies definitely suggest that acupuncture may be helpful. The trouble with acupuncture studies is that sometimes when they're doing the study, they want to make it placebo-controlled. They use sham acupuncture, and sometimes sham acupuncture works well enough so that it's hard to tell the difference between the real thing and the sham, which we would say that shows no difference from placebo.
Let's go to Grand Prairie, Texas. Hi, Charlene. What's the story?
Good morning, Joe and Terry.
Hi, Charlene.
Good morning. My story is I used to weigh about 150, and then I weigh about 125 now, but I walk every day. I walk 5 to 7 miles because I have this goal. I'm 69 years young, and I'm trying to get 10,000 miles by my birthday in August, so I walk every day. I do a little bit of Knox gelatin. I use that occasionally just to be on the safe side. But I used to walk up and down the stairs. Again, I would be embarrassed because my knees would be crackling. But now my knees don't crackle anymore. I can actually run a little bit, and I think I contribute all to exercise. I think exercising is the cure-all for almost everything.
Well, Charlene, I really appreciate that. I think you're onto something.
Well, thank you very much. And thank you all for a wonderful show. I listen to you every week.
Thank you so much, Charlene.
And we hope that you get to that 10,000 miles by August.
You know, Terry, we have heard from a lot of people that Knox gelatin makes a difference. So what are we talking about here?
It's unflavored gelatin. It is actually an animal product. It is derived from beef cartilage, I believe, and people take it as a supplement.
How do they take it?
Well, some people make it into gelatin, with fruit juice or something. Other people just stir it into some hot beverage or food that they're eating. For example, we've had people tell us that they put it in their oatmeal. Somebody else wrote to us to say he stirs it into his coffee in the morning, which strikes me as a little odd, but hey, it works for him.
I think I've also heard about yogurt that you can
yes,
put
you
it
could
in
put
with
it
yogurt.
in yogurt. You could
It probably
put it in
change
yogurt.
the texture rather dramatically, but I don't know.
It might not change the texture as much as you're thinking.
Okay. But people do say it does seem to help with their inflammatory pain.
For some people it does. And for other people, again, it does not so much. Charlene mentioned walking as a form of exercise, and we got an email from Anne in Chapel Hill who says that she had terrible knee pain a few years ago, went to an orthopedic clinic, was diagnosed with a tear in the meniscus, and she chose to do physical therapy, and simple exercises that the therapist prescribed really altered her knee pain completely, which was terrific. So she no longer has the knee pain that was troubling her.
Here's an email from Kenneth in Wilkesboro, North Carolina. He says, Tai Chi has helped relieve my pain. So gentle exercise. Speaking of which, let's go to Don in Tampa, Florida. Don, welcome to the People's Pharmacy. Can you share your story, please?
Yes. I really love the show. I enjoy all the holistic approaches here. It seems like something that a lot of folks should have a benefit to listen to. Mine was, like many others, I had a sciatic nerve that was affecting my ability to do just about anything: sit, walk, stand, sleep. And I sought the advice of our orthopedic surgeon, who diagnosed it as such, and then recommended, before I would see a pain specialist, yoga, of all things. And trust me, I'm the last person who would have recommended yoga to anybody. But as I went and saw the pain specialist, sure enough, this gentleman said the exact same words. Before we start our treatment, I would like to recommend that you try some yoga. So I sought out a yoga instructor at one of the local hospitals, and I can tell you this: in one class, one day.
We just lost what you said. Could you repeat your last sentence, Don?
I said yes. In one class of yoga, 6 months of pain went away in one class.
Oh, my goodness.
It was an amazing, amazing thing that happened. And it wasn't Eastern mysticism or anything like that. It was more of just the concentration of breathing, application, and stretching. I was to the point that I was up to get a handicap placard, and all my desks and computers were going to be elevated to standing height so I can actually function at work. That's how bad it was.
Ooh.
And I was sleeping upright in a chair 2 months prior to this, and that's exactly what took it away. Now, you never eliminate that, but when you feel it coming on again, you know the exact moves to do, the stretching exercises, and it eliminates it again. And I may have an episode that flares up maybe once every 6 months, but within 10 minutes it's gone for the next 6 months again.
And are you doing the yoga regularly?
I am not. That's the funny thing about it. I just happen to have the instructor who had the same exact issue, knew what to prescribe as far as the moves were concerned. And what was funny, I was taking physical therapy and yoga at the same time. Now, not to downgrade or denigrate physical therapy at all, but it was more like, well, here's your next move. Hurry up, you got 10 minutes to go. You know, you're on the clock, that sort of thing. Where yoga is this complete relaxation and total concentration on one specific area of need, and it does work. And I'm just really glad to be able to share that with folks.
Well, we really appreciate that. And Don, you know, the thing that I find especially intriguing about your story is you started this by saying your orthopedist actually recommended the yoga before doing anything more radical.
That's exactly correct. And the pain specialist who was getting ready to do injections into my spine to kill the nerve, he also recommended that. In fact, and this is another part of the story I forgot to tell you, I was scheduled.
Oops.
Well, you know, I think we have just pretty much lost Don.
We're losing our signal from you, Don. You were about to say you were just about to do something, and then what happened?
I was about to get the injections, start a treatment of that, and I called him up and told him, upon his recommendation and our orthopedic surgeon, what had happened. And he said out of the 20 years of his practice, I was the only second person who took him up on that, and the results were the same. And the other gentleman was 75, and I'm 57.
Well, that's a great story. Don, thank you so much for sharing today on the People's Pharmacy.
Thank you.
Bye-bye.
Appreciate you guys.
Joe, a lot of people have mentioned various forms of exercise that really is helping them, and Gerda has written to say that after having one knee replacement, she has avoided replacing the other knee by doing aggressive deep water aerobics 4 times a week. Now, she doesn't do shallow exercises because she doesn't want to be hitting the bottom of the pool, but she's working hard at water aerobics, and it's really helping her.
That's cool. Here's an email from Daz. He says, I've been using Certo in cranberry juice for about 40 days. My chronic knee grinding stopped after the 4th day of use, and I've not stopped taking it since. Extra benefit? Fingernail growth and thickness. Has anyone tried Sure Gel in place of Certo? I'm just curious.
Some people have tried Sure Gel in place of Certo. It's harder to get it because Sure Gel is a powdered pectin. It's harder to get it to dissolve. Now, but there's no reason it wouldn't work just as well.
People often say, well, what exactly is Certo? How do you spell it? Where do you find it? What do you do with it?
Certo, spelled C-E-R-T-O. It is plant pectin, and it is sold in the grocery store in the canning section because it's used by home cooks while they are making jams and jellies. It helps them thicken. Joe, we have an email from Dr. Ashok Patel. He says, I am an MD and have been injecting knees with vitamins, minerals, homeopathic pain meds, and Procaine. No steroids. This is prolotherapy and has good results.
Can you explain prolotherapy?
I was hoping you would.
We've learned about prolotherapy over the last several years, and there are now double-blind, placebo-controlled trials, although I don't know exactly how you do that sort of study. But it's injecting, literally in some cases, sugar water, dextrose, but sometimes they use Procaine, and other times they use just saline. And now they're using, if I'm not mistaken, platelet-rich plasma, and even stem cells, and they're injecting into the joint or into the place where the tissue has become loose, as some people have described it.
Well, as I understand the theory is to trigger a very local inflammation, which then would trigger healing in that place. And I have to admit that I don't know if that's really how it's working, but we have seen research suggesting that it can be very helpful.
Terry, here's an email from Ira in Virginia. Ira says, about 18 years ago, I began taking gelatin by making the Party Jello blocks. After 2 months, my knee pain was gone. Since then, I've been adding 1 pack of unflavored gelatin to my coffee. There you go, in the morning. I'm an avid tennis player, and my knees have been fine ever since. I'm 66. I tell everyone that I know who has arthritis about my experience.
So there it is, gelatin.
Yeah.
In his coffee.
In his coffee.
And good for Ira.
We have just a minute or two left. Mary in Durham, North Carolina. What's this about your diet?
Hi, thanks, Terry and Joe. When I was young, I was in gymnastics, so my joints seemed to be kind of shot. However, I did an elimination diet with my daughter, and it got rid of my head. Wheat seems to have triggered terrible headaches, but also it took me a couple of years to realize that the arthritis is almost gone. The knee popping has completely stopped, and my hips are perfect. It's great.
Well, thank you for sharing that. You know, Terry, whenever I hear somebody who says, I eliminated wheat and my headaches went away,
it's worth checking to see whether it's celiac disease, because celiac disease can cause severe headaches. The trouble is that once you've eliminated wheat, the test for celiac disease is less accurate.
Right. Well, we're just about out of time. How would you sum up what we've heard today? Exercise, crucial.
Exercise, diet control, eliminate the foods that cause you problems.
Some people benefit from nonsteroidal anti-inflammatory drugs, but...
They do, but they need to be used in moderation.
Absolutely. And as far as those steroid injections into the knees, probably
skip that one.
Skip that one. Well, that's all the time we have. Thank you so much for sharing your stories with us today on The People's Pharmacy.
Lynn Siegel produced today's show. Al Wadarski is the engineer. Sophie Copeland and Kimani Hall provided our technical assistance.
And Dave Graydon edits our interviews.
There weren't any.
There weren't any today. The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
And B.J. Liederman has a new...
Yes, he does.
A new album out. His first.
His debut album is out.
We're so excited. To order today's show, you can call 800-732-2334. Today's show is 1080.
Yes, it is. And when you go to peoplespharmacy.com, where you can make that purchase, you can tell us what you think about the show. Find information on prescription drugs, herbs, home remedies, things that may help your arthritis pain or your other types of pain.
You can also subscribe to the free podcast of our show or our free email newsletter. It's all there at peoplespharmacy.com. You can friend us on Facebook. We invite local listeners to also share all of their favorite home remedies at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you so much for listening, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.
Life can be chaotic. If you're running a retail business, don't let disorganized order fulfillment add to the chaos. Use ShipStation instead. With ShipStation, you never have to worry about shipping and fulfillment again. Whether you're running a business out of your garage or you have multiple warehouses, ShipStation is ideal for every phase of your business's growth. Save time with one login for all your stores and by automating repetitive tasks. Plus, you'll save money with the best shipping rates from global carriers. ShipStation's industry-leading features help you deliver a better customer experience. They'll get accurate and faster shipments along with automated tracking updates with your branding. And with up to 88% off UPS and USPS rates and up to 90% off FedEx rates, ShipStation is the fastest and most affordable way to ship. Calm the chaos. Switch to ShipStation today. Start a free trial at shipstation.com/audio. That's shipstation.com/audio.